So I think this is the first time that we've actually had culturally safe care in the clinical colonoscopy standards, and really it's an acknowledgement, first of all, that of the importance of Aboriginal and Torres Strait Islanders and First Nations care. And we know that bowel cancer is the third leading cause of cancer death in First Nations people. So one of the important things for me in talking to patients about colonoscopies is that we ensure that this is a conversation that's had on a regular basis and that it's not so taboo. So with every consultation, it's part of the general list of things. You know, how are your bowels? Is there any changes? And really normalising that conversation. Often the conversation's best had with the patient's next of kin and family and the other important family or group members, and I think that can really open up a conversation around you know, any particular changes that might be relevant or things that have been discussed in the family model.
There are many challenges to ensuring that people in regional remote areas, and in particular our First Nations people, have access to high quality colonoscopy. At GISA, the Gastroenterological Society of Australia, we fully engaged in this with our regional remote and Indigenous network. And we've established a relationship with the Northern Territory Government where we have training fellows in Darwin and Alice Springs. We have a visiting professor program to support those fellows in their units and build not only clinical links but research links with large institutions on the coast. And the third initiative was to establish the Gut Centre program. That's a 3-day conference in Alice Springs that we've held every year for the last 3 years. All the clinical meetings, teaching and endoscopy, working with our colleagues who are experts in gastrointestinal nursing to upskill nurses in the procedural skills and techniques, but also in infection prevention and control. And we undertake a multidisciplinary seminar every night at the Gut Centre program, where we engage with local experts. We bring international experts from around the country to discuss issues relevant to the liver and the gastrointestinal tract, but put it in a context that's relevant for Central Australia. And that's available online in real time to anyone throughout the world that wants to engage with what is the epicentre of gastrointestinal education, that is Alice Springs, every year.